Interesting case. This is a nice young lady from Florida with a lot of inflammation on her right and left chest. And so she has had one set of implants from 2005. And so she basically presented with many symptoms of breast implant. Just the fact alone that these are 20-year-old set of implants, there was a slight chance that these could potentially be ruptured. So over here, as you will see, 100% total capsulectomy, 6525, initials LJ. I removed the skin for contouring purposes. That certainly you can see the scar right in the center, and I removed a lot of tissue here on the side to help with the contouring. The implant, as you can see, relatively very large implant, and I'm very happy and content with how the whole dissection has gone. Complete 100% total capsulectomy. Now, as I was dissecting, there was so much inflammation around, a lot of inflammation grossly around. The tissues were like very, like weepy, if you will. So as I go in, you will see on the inside, relatively thick capsule. If I put my hand, scissors in here, let me go ahead and put this. You can see this is how thin the capsule is. No matter how thin, it has to be removed. And all of this contained. So as I go in, you can see it right away. This is a textured implant, so that's the reason. And you can see how the implant's kind of folded up on itself. And it has like a flat pancake appearance. That's the texture, the nature of these implants. And so you can see how it's folded up on itself. A lot of inflammation. And so you can see some amount of fluid. Remember, none of this essentially this is not enough to send. Not uncommon to see. And this was around the tissue in here as well, all contained. And none of this spilled into the chest. Now if I go like this with my blue sterile gloves, look at this. This is behaving as if this is a ruptured implant. Now if I were to show you on another video, what is this? You're going to say it's a ruptured implant, right? And no, it's an intact implant. And it looks like a brain, if you will, with the hemisphere in the middle. So this is your 480, just like the patient stated, 480 textured silicone implant intact. And overall, I'm going to go ahead and look. Very thin areas. You can see my blue gloves, some areas thick. Some tissue so thin. Very important point to make. This is so thin of a capsule, but it's actually part of the whole continuum, so thick. Oh, that's why all of this tissue had to be removed. So I'm going to cut right here to show you how thick this capsular tissue is. It's kind of one in one. So it's inadequate just to remove this tissue. It has to be the whole thing because that's part of the inflammation. So I'm overall very happy and content how the surgery went. I couldn't be happier. Blood loss was minimal. A lot of inflammation. And look at this. This is essentially dissipating into the periphery. And the capsule is trying to do its best to stop it. Now the left side, in 05 the silicone implants were banned. You could only get them if you were part of a study. So you can see this irregularity right here. And again, complete total implant removal capsule, all of the inflamed tissue. Again, this left side was very inflamed as well. As I go in, intact implant, 480, and I'm going to do it on this side. As you will see, I have a new pair of gloves underneath, the green ones. This is for the Michigan State fans. The right one was for University of Michigan. So as you can see, look at this. If I go like this, so a lot of inflammation, and it doesn't tell you the make or the model, but the 480 and inflamed tissue, a lot of inflamed tissue. You can see again, this is the very thin capsule, but that fatty tissue around is the culprit. Leaving behind this fatty tissue, this yellow tissue behind, is a major problem. in my practice. I take all of it because it's part of the inflammation. So if I cut right through it, just like I did on the right, you will see it's all kind of one continuum. This is all inflamed tissue. So this yellow tissue has to go, this fatty tissue, because this is part of the problem as well. And so I'm very happy and content with how the whole dissection has gone. 100% total capsulectomy. 0% of the capsule inflamed tissue remains behind. All of the inflamed tissue has been removed along with the implant plus the capsule plus anything bad, irregular. There's only good, healthy tissue remaining behind. And as you saw yesterday, the con procedure, the implants will be returned to the patient. Number 2, capsules to be sent to pathology. Rule out the BIA, LCL, CD30 analysis. Rule out lymphoma, rule out malignancy. Cultures for Arabic, anaerobic, and fungal. Twilight deep sedation. She is relatively very young, and despite the 480, clearly she would not need a lift, as I can see on the table. No need for drains, and high definition pictures, videos of the chest wall showing complete removal of the entire implant capsule fascia of the pectoralis major, and she got the twilight deep sedation. And in a similar fashion, complete, thorough, meticulous workup. She has a peace of mind. Number 1, all of that capsule implant inflamed tissue was removed, and number 2, all of it was tested, and so that she has the peace of mind that no surprises await her. A lot of extensive inflammation, like one of the plastic surgeons said, a good reactive chemical reaction between the implant and the body, clearly seen grossly by my eyes as I dissected this off of this young lady's chest. This is Dr. Khan, executive plastic surgeon.